you. Yes. And I'll pay more priority to the YouTube questions. So ask me your questions on YouTube. Now, the person where they ask me about you want to take medication to last long on bed. Number one, let me confirm if you they follow me, first of all. I want confirm something. You know they follow me. Okay, so I'm not going to respond to you. Sorry. Let's see. So that we can ask questions. What are the signs of urinary tract infection? It's not showing live there. It's live. It's live. I'm live now. I'm live on YouTube. It's live now. I mean YouTube. I'm live on YouTube. Don't worry. I'm live on YouTube. You can check again. Yeah, there's somebody watching me right now. There's somebody watching me here on YouTube. Okay. So, hello. Blessing Alpha Ogale. I see you people on YouTube right now. I see you. If you have urinary tract infection, what are the signs? Now, the signs of urinary tract infection can also be like some other medical conditions. Fine, I'm okay. So you have to be careful. Don't make it look like when I tell you these signs, I see you on YouTube. Don't worry, just drop your questions on YouTube. I will answer you. I'm good. So you can have fever, you can have lower abdominal pain, you can have frequent urination, you can have pain when urinating, you can have burning sensation when urinating. You can have a headache, you can feel unwell, you can have loss of appetite when you have all these symptoms as well. So it's not classical. The classical symptoms most times for urinary tract infection, frequent urination, nocturia, waking up at night, and then what again? Feeling like you want to urinate every time, burning sensation, you understand? The people on YouTube, how far? Bidemi, I see you. Thompson, I see you. Tina on YouTube, I see you. Ogale, I see you. Ask me your questions, I go answer you. Just ask me, don't worry. I go answer you. Okay, so there's a question on YouTube. I subscribe to your YouTube. Thank you. Please, if someone misses her period and her breasts are painful and full, but the pregnancy test showed negative, what might be the cause? Number one, it could be psychology. Number two, it could be missed abortion. Number three, it could be molar pregnancy. Number four, it could be blighted ovum. You understand? Number five, it could be hormonal issues. It could be medication, because some women go, they feel the signs of pregnancy, but they are not pregnant. You understand? So I have a video I'm going to upload very soon concerning this. Yeah, it could be that the woman don't miss the pregnancy. Yeah. I fit take anafranil to last longer. So my question to you is, Daniel on YouTube, I'm coming. I'm going to answer you, Mr. Daniel. I beg, I'm coming. If you want me to answer your question, come to YouTube. Why are you taking medications to last longer on bed, Mr. Man? Good afternoon, Andy. Why? Please answer me, or come to YouTube. What name of test to detect diabetes? So, Mr. Daniel, if you want to know if you have diabetes, you can tell them to test you fasting blood sugar, or fasting blood glucose. That is number one. Number two, your doctor. I'm using the word your doctor, please. It's important I mention your doctor here. When you get the results, you go to your doctor. He's going to look at it. If the value is high, he's also going to check you to know if you have symptoms in addition to that. If the blood glucose is high, he might request some other tests. But basically, you can do this for yourself. And if you want to go further, you can do what we call glycated hemoglobin A1C. But basically, just do your fasting blood glucose. Good afternoon. Okay, and even the signs are still on. Yes. Number one, it could be like that. The woman is not pregnant, but the signs are there. It could be hormonal. It could be medication. It could be psychology. It could be even be period. It could be even be period. So I have a lot of questions on YouTube. So I will prioritize my YouTube audience because this YouTube 9 they pay me past TikTok. YouTube they pay me, but it never start to they pay like that, small. So I'm going to prioritize YouTube more than TikTok. Okay, please, what is the best way to reduce weight? Reduce weight in you they chop. Reduce the amount of food you eat. First of all, reduce them well. Reduce the junk food where you they chop, and then try to exercise. Yeah, try to exercise. Most importantly, you also need to speak with a lifestyle expert. Like, get people where they do this thing. You understand? I not just want go. They talk as if say it's all about weight loss. We have to know your weight. We have to know your BMI. Sure, you get. We have to know your weight. We have to know your BMI, and then monitor you to know whether it will work for your body. Does fasting blood glucose detect all kind of diabetes? So this your question is now having a suspicion behind it, because when you say all types of diabetes, what type of diabetes do you know? Please make me understand. What type of diabetes do you know? Type 1, type 2, gestational diabetes, drug induced? Sure, you understand. Okay, so you're asking me, I fit take anafranil to last longer. So I'm asking you, why are you taking anafranil? Why? It's important. I can't just tell you yes or no. I won't even tell you yes, but why are you taking it? How can I have a private discussion or consultation with you? Okay, Bidemi, please, number one, listen carefully. I don't want to make it look like because you see me on the internet, you must have a consultation with me. Because there are people like that. The moment they see anybody talking about health, they want to book a consultation. I don't want to have a biased consultation with you. I want to be sure that you have your doctor, or you have a doctor you can speak around. If you have a doctor you can speak with, you can consult physically, please do so. I will not jump on, I want to consult with you. I'll start, I'm not here to take advantage of people. Not like, So if you have a doctor that you can consult with physically, please do so. Because people have conditions, and when you see somebody on the internet, you want to pay. No. It's important you speak with the one that is closest to you, that you can see. Me, I'm far from you. First of all, let's establish that fact, yeah? But if you don't have, and like you really want to speak with me, how long have you known me? Don't just come on the internet and anybody you see, you want to now consult the person. Nobody's like that. Social media is a very delicate space. Even though I do consultations, but I don't want to have I don't want people to just be consulting with me because they see me, this guy. No. I'm not saying you are asking a very bad question. I beg. Please. I am having sharp pain at the edge of my feet. The side where the small finger is. I was doing skipping, then I felt pain and went for massage to massage the area, but afterwards the pain kept spreading. Patricia, so what I'm going to advise you to do is reverse that thing. Don't massage it. Now your skipping now give you that pain. As you dey skip, so you get how you land on your feet, will cause that pain. Sure, you understand. And when you massage them, you might trigger more pain. So allow that thing rest. I don't even know when it happened to you. I don't know how bad the pain be. I don't know whether it swell up and some other stuff. But the best advice I'm going to give you here is for you to rest that leg first. Yeah. I not get anyone. Okay, so do that one first, yeah. Do that one first, Daniel. The test I mentioned, do that one. Mr. Fred, somebody's asking me a question on YouTube, and he's asking me he wants to take one medicine to last longer. And I'm asking this person, why do you want to take medicine to last longer? That medicine will kill you. That medicine will buy you if you take it when you are not supposed to take it. So why are you taking it? Why do you want to last long? How many minutes will they last long? Yes, I mean fasting. Yes, correct. That medicine can buy you. So when you are telling me it makes one to last longer, so why? Why do you want to take it? Can pregnancy test give wrong result? Yes, it can. You don't know. You get some medicines where you go drink. You get some medicines where you go drink. When you go test, even as a man, if you drink that medicine, you go test them. You go show say you get belly. Yeah, there are some medicines like that. There are some medicines like that. So, the people on TikTok, I have some people watching me on YouTube, and I'm taking their questions more than TikTok. But if you ask me a question here on TikTok, I will try to respond. I better stop taking it then. Yes, please stop. It can damage your life. Oh.
Happy New Year, sir.
Freshman.
You made it.
Ivy now.
I'm good. How you say?
I did. You're looking
How the
fresh.
No, they wind me up. No, they wind me up, please. We're trying to be like this.
You're looking fresh.
Okay,
We get this is a new year. You know we get this.
Why you saying me over and over again?
It's either I end this live session right now.
Okay.
I did live.
Live.
Yeah, I'm live. Yeah.
Okay.
Yeah.
You
come back, Abby? Oh yeah, no problem. Yeah. So we continue our gist. Our last year gist.
Gather everything.
Okay. Good afternoon. Let's see. Nice to meet you on live for the first time. I'm honored. Thank you, sir. Okay. Good afternoon. Please, if you are a young man, listen carefully to me. If you are a young man and you are taking medication to last long on bed, let me just tell you, you will develop problems. And you see those problems, you will spend money, you will pay to get treated. You will develop problems. So I will advise you, please stop taking any medication to improve your performance. If the medication was not prescribed to you by your doctor. My systolic blood pressure 117/127 and diastolic 81/91/88. So why are you bothered? There's a video about the side effects on my page. There is a video about the side effects on my page. I mentioned it. Trust me. Taking medications to last long on bed can affect your heart, can give you problems with your heart. It can affect your manhood. You understand? Yeah. So the people watching me on YouTube, the person where they asked me about blood pressure, your blood pressure is 117 and it's not bad. So what's the issue? Why are you bothered? Okay, let me take one comment on TikTok and I'll go back to YouTube. Which scan can I do? Which scan can I do for recurring infection? Madam, I hope you hear me. If you like yourself, go to the hospital. Don't go and do any test again. See a doctor first. See a doctor first. I beg. Don't do any scan. Don't do any tests. See a doctor first, so that your doctor will check you and then recommend the right test for you. Nobody told you need scan. This nonsense question, stop them, I beg. I'm not saying you are asking a very bad stuff. No, you are concerned. You want to get fined, but you are asking a wrong question, or you are asking an abnormal question, or you are not asking the correct question. The correct question should be, what can I do? What you should do is, please go to the hospital. Go to the hospital. Don't go and do any test. Can pregnancy test give wrong result? Yes, now it can give false positive. It can give false positive or even false negative. False positive or false negative. Yes. Yeah, now tell me. The people on YouTube. So if you want to join my YouTube, go to my YouTube. Go to YouTube, type Dr. Fredo Star. If you are watching me on YouTube, give this live session a thumbs up. Ogale, Ogale. So you missed your period, right? And then you did pregnancy tests. It's showing you negative. So I'm going to advise you, after 2 weeks, repeat your pregnancy test again and see. Yeah? Repeat them again to see whether it dey negative true or it don't dey positive. Okay. Okay, so let's see. What did Dr. T? Dr. T, are you here? Dr. T. Is Dr. Temitope here? Okay, yeah, thanks. Yes. Okay, I'll give you the answer. So when people, I'm having sharp pain. I have answered you now. I've answered you. You said you were having sharp pain at the edge of your feet when you were skipping, and then the pain, you now went for massage. The pain persisted. It kept spreading. I told you, don't do any massage again. Why did you even go for massage? What were they massaging? Maybe you don't dislocate your toe, your toe, the bone. Maybe you don't dislocate them. Maybe. So don't do any massage again. Rest that leg and watch it out and see. I don't even know when this pain happened. I don't know whether your leg don't swell up. So if you were skipping and you notice pain, it might be a dislocation. So rest your leg first and see. Yeah, I don't tire. I think I have to go now. Good afternoon. Well, how about people wey don use chemical to last long? What should we do after stop taking it? Just let your body recover back. Do you understand? Let your body recover. Stop it. Try to eat healthy. Try to exercise. Try to take fruits. It will help your body recover. But if you know, say you don dey take am for a very long time, go for checkup. Go for checkup. Please, what test can I do for frequent urination at night? I don't recommend tests for people here. You must see your doctor first before going for any test. You have to see your doctor first before doing any test. See your doctor first before doing any tests. There are many causes of frequent urination. Plenty causes. It could be from your bladder. It could be a mass. It could be metabolic causes. You understand? So we don't just tell you to go and do this test. Go and test urine, and after you've done test urine is normal. You will not come back. I have done urine test. It is normal. No, that's not how we treat people. There are many things to know. So I will encourage you to see your doctor first so that they can understand this frequent urination, when it started, how bad it is, what is the nature of your job, what do you do, you many things to find out. Then we can now tell you the type of test to go for. Let me take one comment on TikTok and then I'm rounding up. If person BP is very low, what is the cause? What is the problem? The problem is that we need to see that person, examine that person, check the blood pressure again, find out if the person they get symptoms, check some other parts of the body, check the heart, check the kidneys and other things. Find out if the person done any medication to confirm true wetin dey cause the low blood pressure, because low blood pressure get many causes. In some people it might be normal, there's no problem with them. So when you say you get low blood pressure, how did you even know that you have a low blood pressure? Wetin be the blood pressure? Wetin be the BP? You can't just wake up and say I have low blood pressure. What do I do? No. How did you arrive at that diagnosis, because some people go think say their blood pressure they low, but it's normal. It is very normal. So you need to see a doctor and let the doctor confirm true if the BP low. If the BP low, fine. Which symptoms you they get? Because there are some symptoms to see if truly you they get low blood pressure. We go check. You get any of the symptoms? Okay, fine. Waiting they likely cause this in low blood pressure. How old is this person? This person on any medication? Many things. Before we can know, say, okay, do this and do that. That is why every time I always encourage people to see their doctor. I always do that. Social media is not here where we treat people. You understand? I always beg people, no, they collect medicine anyhow for internet. They will buy you. They will buy you through away. Okay. It's been months. So it's been months. So if you have been having pain in your leg for months, I think you should go for checkup. Let them check that leg. Let them check that leg. I beg. Let them check that leg. Because when you say you have been having pains in your leg for months, let them check that leg. You might need to do 1 or 2 tests. They might need to check your leg, examine your leg, do a radiological investigation. Okay. So I have to go now. I don't tire. I'm very hungry and I'm severely tired. Please, what is your YouTube channel name? Dr. Fredo Star. I want to end this TikTok live. Talk to a few people on YouTube and then I disappear. Let me face the people on YouTube quickly. So if you are here on TikTok, you can go to YouTube now, search for Dr. Fredo Star. Quickly, you will see me live. For the next 10 minutes, I'm going to be here to talk to them. Bye-bye. Okay, my mom have survived ear pain for a month now. Okay, Leonard. I hope your mom is better now. I hope your mom is okay now, right? Good. If you have questions, please ask me. My attention is focused on you right now. And then give this live session a thumbs up, please. At least give this live session a thumbs up so that yeah. Okay. Yeah. So what's the question now? No question. I'm leaving. I'm waiting. No comment, No comment, right? Okay. What's to do? So that pain in your leg, that pain in your leg, please get it checked, because the pain has been there for a long time. The pain has been there. It might be there for a while, but I can't really say why it's going to happen. You might have damaged your ligaments or the joints. Do you understand? Juliet, okay, Juliet, I can see you. Oh yeah, ask me your question, Juliet. Juliet, oh yeah, ask me your question. Okay, I'm waiting. Okay. Yeah. Okay, I'm waiting for you. Ask me. I know some people just came from TikTok right now. So ask me your question, yeah? Let's go. Please, if person BP is 60/90, what is the problem? So your blood pressure cannot be 60/90. Listen carefully. Mr. Musa, you are on YouTube. There is a video on low blood pressure. is on this YouTube. I explained some people have your BP cannot be 60/90. You are missing it up 90/60. For some people, this value can be normal. For some other people, it is abnormal. So we need to be sure if you are having symptoms associated with 90/60. Because for some people, it is normal. You dey hear me so? Ima Kamara, how are you? God, I beg, oh, hunger won't wound me. Oh yeah, oh yeah, oh yeah, oh yeah, yeah. Oh yeah, oh yes, yes. So, Mr. Musa, I have answered you. I have answered you. For some people, it can be normal. So we need to be sure if you are having symptoms. You can't just wake up and say, "My blood pressure is low." Why? What do I do? It's not. It's not enough to just conclude that you have a low blood pressure. Yeah. Is that okay? Any more question? I'm waiting for you. Any more question before we disappear? My number is 153/19. What can I do to lower it if I don't want to begin to take the medication? Juliet, listen carefully. Listen carefully. Listen carefully. I am not on the internet to put people's life at risk. Eh? If your doctor recommended medication for you, if your doctor listen, can you hear me? Listen carefully. I want to end quickly. If your doctor recommended medication for you, take it. Don't discard your doctor's advice and come to the internet and be looking for alternative. And then when the alternative begins to give you some problems, now you start running a skater. So if your doctor recommended medication for you, take it. What can you do in addition? Exercise. Cut down on junk food. Cut down on fatty foods. If you are overweight, if you are obese, try to cut down on your weight as well. Reduce those fizzy drinks drastically. Stop them. It will help you in addition, especially if your medication was prescribed by your doctor. But don't discard your doctor's advice. Discard the medication recommended to you by your doctor and then come to the internet and you're looking for alternative therapy. We don't do that here, please. I'm very, 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 very careful of what I say on the internet, and I don't want you to joke with your life, please. So if your doctor has told you to take this, take it and add some other stuff, please. Before somebody will now tell you to go and drink ginger, you will now drink all the ginger in the world. It will not work for you, and then your BP is gradually elevated, and then one day you will now say, it's that doctor online that told me to stop taking my medication. Is that okay? Okay, so in the absence of any question, can we call it a day? Okay, yeah. Any more? I dey wait for you quickly. Some people came over to some people came to TikTok. Okay, no questions, right? Are we good? We have to go now. Thank you very much. Okay, take care of yourself and have a wonderful day. I'll see you later. Remember, good life, not sense. Bye bye.